Hey, this is the cancer video, right?
This is the one.
Yeah, let's go ahead and skip the singing and just start this one.
Yeah, MK, hurry up.
Shut up, other room guy, that's what I'm doing! Quiet guy, start the video.
Okay.
You know what? I was asked a long time ago to do this video, but at the time, I thought it was insulting for you to even ask me to do. I mean, I get why you would want me to do a video, but I'm like, dude, it's a fucking disease. I don't want to talk about that shit. One, I don't especially like talking about myself. I mean, I love me. I'm totally fucking cool, but I'm around me all the time. I know me. I'm not so much a fan of myself that I can just sit here and talk about me. I mean, how long have I been doing this before I finally dropped the truth about the skits bomb on you guys? I don't like talking about myself. And two, it's a sad story. I don't like sad stories. I seriously don't. I have enough sad stories. I've heard enough sad stories. Don't fucking like sad stories. The really fucked up part about it is you motherfuckers keep coming to me with sad stories like I'm your fucking uncle and you can just tell me sad shit all the fucking time. Just random people coming up to me like, oh, MK dog, I gotta talk to you about something serious. And then they'll send me 2 pages worth of shit. What? Like I gotta scroll down and read it all. I don't fucking get it, I'm serious. You guys treat me like your uncle. You keep coming to me with this really personal shit. I have on more than one occasion had a woman coming to me talking about, oh, I was raped. And I'm like, I'm really sorry. I feel for you like you wouldn't believe. But why are you telling me this? You need to tell the police. Look, whatever, I don't like sad stories. But I've been doing this for a while now and you guys kind of expect me to talk about myself, and I have been recently, so I guess I'll talk about this a little bit too. But first I want to explain exactly what cancer is because honestly not everyone knows. Cancer is just the uncontrolled growth of cells. That is it. It's not some out of your body thing. I don't know what the fuck you think cancer is, but that is it. There is cancer present in your body right now. If you have cells, you have the capacity for cancer. There's an abnormal cell in you right now that's just mobbing through you, bad as shit, like, yeah, I'm gonna fuck this place up. And if left alone, he'll metastasize himself some homies, and before you know it, him and his crew will be bad enough to call themselves a malignant tumor. That's malignant, meaning potentially fatal, not benign. Benign means you're fine. Anyway, you have those cells in your body right now, but your body is also killing it right now. Now, my story. It begins with a fight with a Mexican outside of a phallus paratus, or however the fuck you say the name of that store. It's a Mexican clothing store. It's really cheap. It's out here in Arizona. Whatever. Anyway, I tuned that guy the fuck up. He was shorter than me, and that almost never happened, so I just let loose on him. Don't get me wrong, he wasn't a chump. He fought back. Matter of fact, he got me good. Boom! Right in the middle of the chest. Knocked the fucking wind out. Not even gonna lie. And after a few weeks, in the middle of my chest, I see the smallest little lump. Like, not even as big as an M&M. I think, no big deal, it'll go away. But as weeks pass, the little lump gets bigger and bigger and bigger. I start to think, man, this man's skin must have got me pretty good. Like he fractured my sternum or chipped a bone or something and it's trying to calcify the floating fragments or look, whatever, man. I was trying to get any excuse. I don't like the fucking doctor. I don't like to go to the doctor. Oh, God, I waited so long. It grew to a size comparable to if you were to cut a baseball in half and then stick it under my skin, right in the middle of my chest. And still I didn't go to the doctor. I know you guys are probably out there like, oh God, you're so fucking stupid and black, God. I know, God, it was so stupid. But then I started feeling really tired all the time, and I would cough non-stop, which is why I thought I was tired all the time. I couldn't sleep. I was coughing all the fucking time. The coughing just went on for weeks and weeks, and still I didn't go to the doctor. I used to work at this old hole-in-the-wall kind of rednecky bar. Oh God, the old dogs that used to go there used to give me such grief over that fucking cough. They were cool though. It's the old people that you can kind of shoot the shit with. Shouts out to all you old farts at the foxhole, which isn't even open anymore. Man, that sucks. I think I'm gonna digress a lot in this video. Anyway, I didn't go to the doctor until I started coughing up blood. I remember I was having a fit. Just and I looked down and there it was. It was fucking blood. Right there. Right on where his lip is. Would have been right there. Why am I being weird about it? So I finally went to the doctor, had all the scans and x-rays done, and I waited for my call. And then it came. Her name was Dr. Ruth Sanders, just the sweetest little old white lady. She was so funny too, you guys would have loved her. She calls me up like, MK, we finally have your scans back. We need you to come down to the office ASAP. And I say, oh, okay, good. Well, how's it look, Doc? And she says, you know I can't tell you that. We need you to come down to the office. And if you can, have someone close accompany you. Maybe your mother. And I say, oh. I, of course, didn't bring my mother. She's not the type of woman to... Look, whatever. Well, whatever, man. I just didn't bring my mom. Anyway, I drive down to her office where she sits me down, takes a deep breath, and looks me right in my eyes and says, son, you have a tumor in your chest bigger than your fist. So big, it is pushing your heart and lungs out of place. And that is why you can't breathe correctly. So big, it has separated your sternum bone and has grown out and onto your chest. And I just sat there and looked at her. And again, all I could say was, oh. Nothing dramatic or poignant, just, oh, that's it. It was nothing like you see portrayed in movies. I've seen it portrayed exactly the same way in both Breaking Bad and that movie 50-50 with Seth Rogen and Joseph Gordon-Levitt. The person's vision goes all out of focus and there's a ringing in their ears. Man, it was nothing like that. I didn't feel anything. No emotion at all. I don't know what that says about me as a person, but yeah. Nothing. I mean, I have this whole personal thing about death. I mean, that's a whole different video. It's one video at a time, folks. Oh, something else I learned about myself that day. I was born with a birth defect. My sternum bones aren't fused like a normal person. Your sternum bones are supposed to fuse like the bones in your skull. Not mine. Mine's are rebels. Look at all you out there with your fused sternum bones. Conformists. So, shortly after that, they ran some more tests and performed what is called a punch biopsy. It's when they take what is basically a big fucking pen thing with a needle in the middle of it, stick it in the tumor and punch out a sound. Real quick, my tumor was so dense it bent the surgical steel needle. They had to go and get a bigger one. That's also why I took forever to go to the doctor. I honest to goodness thought that was bone. The tumor felt like bone. When I think of a tumor, I think of something that's, you know, like mush, like a liver or a sack of meat or something. Mine was like bone. But even with the second attempt at sample extraction, the results from the test were inconclusive. Now, before they even started treatment, they had to know exactly what type of cancer I had, so they wanted to go in and surgically remove a portion of the tumor to, well, get rid of part of the fucking tumor and to get a better sample. I remember that day. They kind of sprung it on me. They didn't explain to me the true gravity of the situation until I was going into surgery. They made me sign this waiver freeing them of any liability upon the event of my death, and I was like, what? The surgery involved a very real possibility of them nicking an artery in my heart and me bleeding out and dying. They sprung that shit on me 30 minutes before the procedure, and that soured my mood a little bit. Don't spring that shit on me last minute, what the fuck? Hey MK, how you doing? About as good as I could be doing, I guess. Yeah, that's good. Look, we're gonna need you to sign this document saying that we might kill you today, but you're okay with that so your family can't legally hold us liable. The fuck did you just say to me, bitch? And that's some bullshit, by the way. If you kill me, then yeah, you're responsible for killing me. Fucking doctors, man. I fucking hate doctors. Then they sent in a priest to come pray with me before I went in, and I just lost it. I'm not even Catholic. I looked him right in his face and told him to get the fuck out. I told the priest to fuck off. Jeez, what the fuck is my problem? And then my mom got all upset, and I told her to fuck off, and she didn't like the way I was acting too. God, I was rotten. I don't know what my problem was that day. It probably had something to do with them springing death on me 30 minutes before I was supposed to be there. I was like, fuck man, come on, I didn't even get any pussy today. Now, you might be wondering, MK, why are you wearing a button-down shirt? You never wear button-down shirts. Well, that's because I thought it would help with the visual in this part of the story. Now, the surgery was supposed to go like this. They made an incision here at the base of my throat, then went under my breastbone to remove some from the inside. But what do you know? They nicked my fucking artery! But they were able to stop the bleeding. I didn't die. Obviously. So they went in again. They ended up making a second incision here, right on top of the tumor. I don't know if you guys can see it. For some reason, it's not nearly as dark as the one on my throat, but it's right from here to there. I don't know if you guys can see that. Anyway, they cut a chunk there, and that was their sample. I was officially diagnosed with Hodgkin's lymphoma March of 2009. And I was healthy. I was a student athlete. I never smoked. I drank only on occasion. I was healthy. Hodgkin's lymphoma is a cancer you get for no fucking reason. My initial survival rate was 88%, but after all the scans and the tests came back, that number got bumped down to 50%. So you flip a coin. Heads I live, tails I die. That's the best the doctors gave me. Now I'm sure some of you out there are like, MK, why'd you leave your shirt unbuttoned? What are you, an R&B artist now? Put your shirt back on, Just shut the fuck up. Shut your mouth. I left it open for a reason, you fucking prick. Shortly after that, I underwent another procedure to have a portacath implanted into my chest. Now what that is a little plastic piece about this big that they inject chemotherapy drugs directly into via incision here. Plastic piece goes there, and connected to that is a little plastic tube that they run along here, and there should be a little incision there. You guys won't be able to see it, it's too small. They make a little incision in your jugular vein, and they thread that little tube directly into it. So the chemotherapy drugs that they administer through that goes directly into your heart. Why? Because if they were to try it in your veins, it would basically disintegrate them. The drugs and chemotherapy are too harsh. They need to be in your heart. I remember the meeting I had with the head nurse at the clinic that administered the chemotherapy. I finally told my mom. I waited like 2 months. I waited until it was time for chemo to start to tell my mom, but she was there and it was hilarious. First, she handed me this list with a bunch of funny names on it and told me these were the medications I was going to be on during chemotherapy. There was a list of 13 separate medications. She explained to me that these are the ones that are going to cause you pain and sickness, and these are the ones that are going to make your hair fall out, and these are the ones that are going to make you sterile. Oh my God, when my mom heard that, she broke the fuck down and started bawling her eyes out. Oh God, Lord, please Jesus, no, he done took my grandbabies. Lord Jesus, why? I had to comfort my mom at my chemotherapy meeting. Fucking bitch. I was more concerned about losing my hair. I had dreads at the time. I love my dreads, man. My dread game was cold. I was 21, I didn't care about having no babies. At any rate, yeah, she just rattled off a bunch of medications. I remember one made my pee red look like Kool-Aid. But yeah, started chemo soon after that. And for those of you that don't know exactly what chemotherapy is, because I honestly didn't know until it was time for me to go and have chemotherapy, it's just sitting in a chair for 3 to 4 hours depending on how much medication you need. That's it, you're just hooked up to an IV for 3 or 4 hours. Oh man, but that movie I mentioned before, 50-50, I want you guys to watch that. That scene where he goes and gets chemo for the first time, those 2 old guys, that happened to me almost exactly. He offered me cookies and everything. They just weren't weed cookies. They were in that the Christmas tin that, you know, when the cookies are gone, your mom or granny uses it to hold her sewing equipment in. He gave me those cookies. They weren't weed cookies like in the movie, but that happened to me. This wisecracking old white dude would bust my chops every time he see me. We had the same chemo schedule, so we would sit next to each other every time he came in. We would roast each other so much. He was the coolest old dude, I swear. I remember the first time I met him. He went in immediately. Yeah, get this kid out of here. What, this kid got cancer? Get out of here. They lied to you. Go out there and get into some trouble, kid. Look at this kid's shoes. Why are they so clean? I bet he goes home and puts them in the freezer to keep them fresh. He was so funny and he was always on. And yeah, man, just like in the movie, he said chemo would shrink my dick. Hey kid, you know what this stuff does to you, don't you? It shrinks your dick. That's probably why they got you in here. You're too young, you don't got cancer. They said, send this kid up in there, hook him up to one of these IVs. His dick's too big, they gotta take some inches. I looked at him like, shut up, old man. For real? And just like in that movie, his friend, he had bone marrow cancer. His friend died. He didn't tell any jokes that day. Another little something about me, not a single person came with me to my treatments. Nobody. I would always see the person's family or spouse or friend or some shit sitting with them during chemotherapy. Not me. Don't know I give a fuck about me. In fact, my girlfriend at the time left me. Took off. Not because of the cancer, but despite the cancer. Oh, I take that back. A lesbian couple I had made friends with at the bar I used to work at, they came to one. A random ass lesbian couple. They were really good people though. But things gradually started looking better for me. What was left of the tumor on my chest started to fade away until it wasn't there anymore. And I knew it was going to be okay. After a few months of chemotherapy, I underwent a few weeks of radiation, which by the way is more what I thought chemotherapy was like at first. It's basically, you know, just sitting in a chamber like an MRI or a PET scan for 30 minutes or so. It's nothing like chemotherapy. A few months later, I was tested again and I was officially in remission. I had made cancer my bitch. It was only then that they allowed me to get my port removed. They didn't want to remove it prematurely in case I needed more chemotherapy, but they did. And here it is. Yep, they let me keep it. Let me take this out so you guys can get a better look at it. That's the port right there. That was in me right here for about a year. See that little tube at the top? That's where the little plastic tube goes. Man, I was so happy to have this out my chest. And oh man, after some more tests, turns out I had a blood infection for who knows how long. I could have died at any time. I should be dead so many times over, it's ridiculous. This video is running long, I need to wrap it up, and I want to do so with some advice. People often ask me what they can do to help the person they know battling cancer. What can they do to support them? And do you know what I tell them every time? Leave them the fuck alone. Don't coddle them. Don't ask them every fucking hour if they're okay. They're not okay. They have cancer, you fucking asshole. Shut up. They don't want to be reminded of how sick they are every time they see you. Just do whatever it is that person needs you to do. And more often than not, that's just be normal. Just be normal around that person. Folks, if you haven't battled cancer, then you don't know. You don't know how terrible it is. It's worse than anything you've ever been through. Just for a moment, I want you to imagine having a stomach virus that never goes away. You're just sick all the time. But that's not it. Imagine being in pain. A deep ache all through your body, in your muscles, in your joints, in your bones, in your skin. Imagine that pain never going away. For weeks and weeks and weeks, that pain and sickness is there. Chemotherapy doesn't just kill cancer cells, it kills every rapidly dividing cell in your body. That's why your hair falls out and you're throwing up all the time. And your bone marrow, that's where your blood cells are made. That's where your immune system comes from. During chemotherapy, a cancer patient can become as immunodeficient as an HIV/AIDS patient, which is why that blood infection should have killed me. Look, it's tough, okay? Some days you just want to quit. You just want to give the fuck up. And I don't mean you want to die. You don't want to die if you have a chance of living. You just want to go to sleep. And when you wake up, it's over. So support that person. Make them laugh. Don't let them remember how sick they are. I always thought that if I did a cancer video, I would link you guys to certain cancer research funds that you could donate to, or even auction off that port and then donate that money to cancer research, because I'm sure some weirdo out there wants to buy something that was in me for so long. But fuck that! Fuck cancer research. Do you know why? Because we already have more than one cure. I'm going to link you guys to a couple of videos explaining them in the description. I want to know why these methods aren't being implemented today, right now. And no shit, I know it's because a bunch of deep pockets are profiting from the continued suffering of people with cancer. I know that, but I want to know why we're allowing it to happen. I want someone to explain to me the ramifications of the cataclysm that will befall our healthcare system if we allow it. I want someone to explain it to me. And lastly, if there is anyone out there that knows of a way I can lend my voice to the effort of making these cures available to the people that need them, let me know. Don't message me wasting my time. I don't want to talk about it. I want to do something about it. I want to join an established grassroots movement or work directly with an upstanding politician that actually gives a damn about this stuff. I know they're out there. I just gotta talk to them.
Wow, that was pretty long-winded.
I know it was good, huh?
What? No, that's not at all what I just said.
I know it was humorous, but also engaging and intimate.
That's not even remotely close to what I said, MK.
You know what, quiet guy? You say such nice things, I'm gonna have to start calling you Nice Quiet Guy.